Good morning, good afternoon, and good evening, depending on what time you are accessing this video. My name is Dr. Ram Sanasian, and I am the chairman of Imperial Medical Solutions. My role is to promote the philosophy and the strategic direction of Imperial Medical Solutions globally. I'm also a consultant pediatric radiologist within the NHS, where I'm heavily involved in the care of patients and in education. I was recently, and still am, the founding member of the World Federation of Emergency Radiology COVID Task Force. I sit on other various international committees. And I also work within the teleradiology industry. My talk today is going to be on the technologies and services to defeat COVID-19 and the solutions that IMS brings to the table through our partners in Malaysia, AGIMS Asia. I would like to go over a bit about IMS and what we do. We are a clinically led organization that provides a broad spectrum of solutions to the medical field. And we also offer project support to healthcare organizations and medtech-based companies in achieving their strategic goals. We have within our organization a growing pool of world-recognized leaders in various fields, not only in healthcare, but also in human factors, in artificial intelligence, robotics, and health informatics. And we aim to bring all of this to promote the best in patient safety through the use of these technologies and developing strong human relationships. Since inception, we now provide various services to UK-based medtech companies and have forged alliances with other partners in the UK, in Southeast Asia, the Indian subcontinent, and the Caribbean. We have a mix of capabilities through our clinical leadership and technology-based solutions, and this aims to provide focused support to healthcare organizations and promoting patient safety through the use of our clinical leadership, the technologies we have available, and forging strong human relationships. As I've said before, we have an advanced suite of products and services that include robotics, biotechnology, artificial intelligence, virtual desktop solutions, and also a digital transformation services, incorporating the use of grassroots local knowledge within the countries we work in and using pre-existing local networks to meet the needs of the various healthcare systems we are involved in. Our mission is quite simple. We aim to evolve with our partners and to continuously deploy cutting-edge technology to improve the delivery and reach of healthcare systems across the world. We advance this by having a proactive approach and speaking to our clients, our clinicians, and adapting to patient needs. This will allow, of course, the best possible experience. And thirdly, to empower by bringing together healthcare providers and organizations with clinicians, using the technology and skills and expertise we have to deliver outstanding care and patient care delivery. I'd like to introduce you to the founders of IMS, where we are based in the UK. We bring with us over 40 years of clinical experience combined. The organization is led by myself as the chairman. We have a medical director, Mr. Samuel Hark, whose role is to ensure patient care is maintained and safe by constantly evaluating the evidence in front of us with regards to the technologies and services we deliver. He brings with him extensive experience within the healthcare industry. Our CEO is Professor Tanara Lampulam, who is an eminent laparoscopic surgeon in the UK well recognized worldwide, and holds several honorary fellowships in various surgical colleges. And the last member of our team is Ms. Nazia Aftab, who is a lawyer and leads our strategic services and gives us advice on best plan forward and acts as our chief operating officer. And in Malaysia, we have AGIMS Asia that's led by Mr. Chong Sun Yong, who's our CEO. He's trained at Warwick University in the UK as an engineer and has been head of Reuters Malaysia for 15 years until he retired. He runs the Avant-Garde Center of Excellence and brings extensive experience in the business sector with a strong network within Malaysia and outside Malaysia. And it currently sits as the president of the Malaysian Autonomous Intelligence and Robotics Association. And CFO is Mr. Meng Soo Ho, who's an accountant and entrepreneur and brings with him also significant experience in the business world. Our clinical team is led by Dr. Tikrugi, who is an eminent laparoscopic surgeon who works at over 3 hospitals in Malaysia and sits as a secretary of various societies within surgery. He brings knowledge and understanding of the healthcare services within Malaysia. We also have a Caribbean team in development due to our growth. And this is led by Dr. Zainul Khan and supported by Ms. Sadia Mona John, Dr. Raquel Lowe Jones, and Mr. Trevin Chitoli. Their role is to assess and to see if the Caribbean market is right for us. And we're already in discussions with several national stakeholders and local universities. So the future is bright for us in the Caribbean, and we hope to see that launching very soon. And as you can see, our network is growing since inception. We have multiple partners with footprints around the globe. And as our group of partners grow, so will our footing worldwide. And this allows us 24/7 support to any of our clients or partners around the world. One of the main areas that we specialize in with the use of our partners with extensive experience is in healthcare digital transformation solutions. And this is multifaceted. It starts with defining what the patient user experience should be, helping develop communication systems within healthcare, preparing the tools required for digital transformation in healthcare institutions. And just some of the technologies we deal with will include telemedicine, which a lot of you may already have some experience with, but we bring in significant security features and global reach through our technology. We deal with augmented reality and virtual reality. We deal with Internet of Medical Things. We have within us artificial intelligence and robotics. We can deal with wearables, and also something on top of most hospitals' list, electronic health records, making sure that data is safe and secure. And I'd like to talk a bit about the digital transformation journey. It's important for business to understand that while new technologies may look to threaten established businesses, they can actually create unprecedented opportunities. So we should accept them with open arms. And it is not digital disruption that drives companies to change. It is actually the digital fear of missing out. You don't want to be left behind. Imagine if right now you do not actually have internet in your hospital. 20 years from now, you do not want to be the same hospital that has not undergone a digital transformation journey. And as it is a new area, IMS and our partners, we also specialize in dedicated training programs to eradicate those fears, to support healthcare organizations in the use of technology so that they get the best return on investment. We take you from start to finish and continuously care for you after that. And while we take you on this digital transformation journey, we help you with the concept of it, with final delivery and follow-up. We help you maximize your revenue opportunities by making smart marketing decisions with your technology. And we also have to take into account that local digital transformation solutions have to appreciate cultural differences, so there are no one-size-fits-all. And this is just a good infographic about how we take this journey, where we will bring in external ideas, we work with your internal ideas, we discuss what we would like to achieve, we work with you, we engage, we co-create a solution. And through that, we support the existing markets and also help create new markets for you. In particular to healthcare tourism and using digital transformation technologies to widen your reach. And this is a good example of the seamless ecosystem and journey that we can go through with IMS in your organization, where the two key stakeholders are on the left-hand side, the patient, and on the right-hand side, the healthcare organization. And we can improve the patient journey by how they access healthcare through online booking and teleconsultation, helping with diagnostics, pharmacy and drug delivery, and remote monitoring technology. This, of course, will coincide with the hospital's use of technology, with staff CRM, using electronic health records, scheduling capabilities, using radiology technologies such as risk packs. And this will then touch with the patient journey experience with a local and global network and scheduling capability for online booking. So you can see how we can use technology to not only improve the journey of the patient, but also for the healthcare organization. And so there are multiple benefits of using Imperial Medical Solutions. We provide a portfolio of expertise and technologies that include remote diagnostics, digital transformation services, which could include telemedicine, teleradiology, robotics, electronic health records. We can help you with service developments. We have, through our partners at InsightAGIMS, which I'll get to later, a global clinician database for worldwide support. We have an extensive network and have developed relationships with key strategic partners worldwide. We can help with medical assessment using our experts worldwide. We can provide you with education and opportunities to upskill your workforce. And of course, to our partners at InsightAGIMS, telemedicine platforms. And so now, as we are in a very trying times in our history with COVID, IMS has taken a step to provide you with some of the technologies we have in regards to the fight against COVID that can help your organization maintain better resilience. Out of our portfolio of technologies, we've identified 3 key technologies that can make your resilience and service better for your patients. The first on the left-hand side is the Freehand, which is an adaptable, agile, and affordable robotic surgery adjunct, which costs about 20 to 25 times cheaper than the more recognized surgical robots that run into millions. This, of course, allows more organizations and patients to have access to digital surgery. And this is a UK-based company that we work very closely with. And we're expecting market entry into Malaysia sometime around June, July 2021. We're working very closely with the Malaysian branch of the British High Commission on achieving this with our local partners. In the middle, you'll see Gnosis. They are part of the MedX Global Group, and they have developed a highly secure global telemedicine platform that allows remote monitoring technology to plug into it. And it uses Wi-Fi, 3G, 4G, and the future 5G, but also has satellite link-up capabilities that allows telemedicine access from anywhere in the world, even from the most remote of locations. And on the right, you'll see Mitis Health. They are our partners who develop a next-generation networking solution providing highly secure, high-speed, non-data transfer, virtual desktop capabilities, which means you can securely have your hospital desktop anywhere in the world accessed from the home of one of your clinicians or nurses so that they can work remotely. As data does not leave the hospital, it's only pixels. And it's something like Netflix, but very secure. And it is one of the only companies in the UK that is recognized by the Royal College of Radiology for the standards and NHS. With regards to our services, we work with two very eminent groups. On the left is MedLab, where they deal with human factors training and creating safer healthcare through crafting and creating roadmaps to improve team performance. Because you can have the best technology, the best people, but if you don't have human systems integration, that is when you run into trouble. And this is where they give us full support. And on the right is AI Digital, and they manage all our projects and implementation. They have extensive experience in delivering projects to time, and they are preferred partners when we have a large project. I'd like to spend some time on Freehand, the robotic surgical adjunct that could be of interest to many private hospitals as they try to take the robotic trajectory. This is essentially a robotic camera holder for laparoscopic surgery that can be used for thoracic surgery, gynecological surgery, urological surgery, and general surgery. And it is adaptable, it's agile, and it's extremely affordable, allowing more surgeons and more hospitals to have access to it and more patients to acquire surgery using robotic technology. And that's 5 key areas that makes this a key competitive in the robotic market. Firstly, rock-steady image, allowing better view by the surgeons. It gives much better surgical control, as now the surgeon has 100% control of his environment and surgery. It is shown to reduce surgical time by approximately 20%, increasing your workflow and work volume. Because of technology, it optimizes the surgeon and operating team ergonomics and preventing back pain. And due to short surgical time and the technology associated with it, it actually increases patient safety and team safety and reduces the likelihood of COVID infection. It's far more cost effective and is very intuitive and only takes 1 or 2 days to learn, or 3 to 5 surgeries to get used to technology. So this is something that should be considered. The next technology that we work with is Ignosis, our partners, who have global telemedicine and remote monitoring technology. As you can see on the right-hand side of the screen, it allows access for patients from anywhere in the world using highly patented products. It allows remote monitoring, either at home or in remote areas. It allows time and cost savings, where patients can have much better access to doctors using our telemedicine platform. It allows physicians to look after the health of their patients better. We're certainly market leaders in this, because this technology is currently used by the French military, by Médecins Sans Frontières, by the Australian Air Ambulance, and it's currently on 600 container ships. The platform is highly secure, fulfills the hyper compliance and GDPR compliance with data security, and fulfills all Malaysia data security provisions. And because it is global, it allows reach beyond the borders of Malaysia. And this is, of course, would be of interest to anyone developing health tourism. The next technology that we're excited about is Mitis Health. Our partners who have developed a next generation remote solution that allows you to stream your hospital desktop to any remote location without the compromise of quality, speed, and security. This can be used for two uses. Firstly, in radiology. With the right equipment, you can have high quality radiology images with 100% lossless of image quality, making sure that the patient receives the best care from the radiologist. It can also be used for clinical desktops, and it is very secure because no data leaves the hospitals. So it does not expose your hospital to virus, malware, or malicious codes from remote locations. It is compliant globally, and it also conforms to radiology requirements of the Royal College of Radiologists and NHS England. So it can be used for radiology or just for clinical desktops. It's high speed because you're not transferring data, you're only transferring pixels, and is resilient. You can access your hospital computer or virtual computer anywhere in the world, and this requires low internet bandwidth, which makes this highly desirable. Now let's move on to our services that we provide. A key area, of course, is human factors, which is a growing field in the UK and the US. And it's about high performance training and support packages that are designed for the healthcare industry to bring out the best in your healthcare organization. And this is particularly important when you're dealing with different groups of people and different technologies. Now, with regards to COVID has required a huge amount of creativity, innovation, collaboration, and adaptation. And these behaviors require us to access our very highest level of cognitive functioning. Of course, working through COVID has also been enormously stressful, and stress has a huge impact on our performance. It can either push us to think and be at our very best, or the complete opposite. First, to go into very rigid and protectionist thinking and behaviors. If the conditions we work in are poor from a system and team perspective, information is difficult to access, and lack of user-centered design, not feeling part of a team, or the lack of peer support and fear of blame or mistakes, stress tends to initially improve performance. And then it will decline. And the decline can be very rapid and to very low levels. If, however, the conditions we work in from a system and team perspective are psychologically safe, we feel part of a cohesive team with high levels of peer support, we believe we won't be blamed for mistakes, and we are able to access this information and resources as we need it. And this is likely to be continued positive correlation between stress and performance. In essence, if you properly embrace human factors and system thinking, then you enable people to be at their very best under pressure. Given that we cannot possibly remove stress from working in healthcare, let alone during a pandemic, we need to create team and system conditions that allow healthcare professionals to deliver their potential. And so, through the various training programs provided by MedLab through IMS, we can make sure that your team achieves the best in performance, which will ultimately improve in patient care. The final organization that we work very closely with is AI Digital. And when we talk about all the technologies and all the services, you need an effective project management team that has experience in delivering things to time and within budget. AI Digital has had several flagship programs and projects that they have supported. This includes the setting up of the UK Biocenter COVID-19 test lab. They work currently with the Sanger Wellcome Institute on the 100,000 human genome sequencing project. We're also involved with the Lighthouse Lab Sustainability Project for COVID-19, and they also support the Sanger malaria generic sequencing project. They are recognized worldwide. And what happens is when we have a project that is large, they will help us project manage it and make sure it's delivered in time. They will support your existing infrastructure and help come up with a strategy. These are people who have been in the game for a while and know exactly what they're talking about, and are our preferred partners in helping you deliver your digital transformation strategy. And that is what we are at IMS. We are an end-to-end solution of clinical leadership that defines our role. We work with you. We bring in our clinical framework, our networking and clinical governance to make sure patient safety is always maintained. We combine it with the platform and IT infrastructure and clinical hardware and technologies. And we bring in knowledge and expertise based on various clinical and geographical locations and support you from start to finish. And if you're looking at how we can rapidly deploy solutions for your hospital or your organization with our suite of services, we can bring all of this under one package, helping you with networking through Midas Help, allowing your staff to work flexibly from home, which will allow business continuity while maintaining social distancing measures. That can include Ignosis, where they will use their telemedicine technology, again, to allow business continuity. We have freehand technology that helps you in your operating theaters, reducing surgical times, less staff required because you do not need someone to hold the camera for surgery, and reducing the aerosol disbursement, which contributes to less COVID-19 risk. And all of this can be supported by our partners at MedLed to bring out the best in your team. And all of this will be wrapped up by AI Digital to make sure that everything is delivered on time and to your specifications. So what will our journey together look like if you're interested? Well, firstly, connect with us. Let's have a meeting and let's talk. Let's explore these opportunities together. It has to be bespoke to your particular requirements, as there is no one size fits all. You can't just buy technology and put it into your hospital. It has to be planned in a considered and measured way to ensure sustainability. We will explore the various technologies available, and if there's something that's not within our portfolio, we will endeavor to get it for you. And then we'll plan this journey and pathway that is right for you. And so, as an end-to-end solution, we can be with you from start to finish. So with that, I'd like to thank you for your time, and thank you on behalf of our partners who have worked closely with IMS in delivering this slide. And if you need to contact us, please contact our CEO at AGIMS Asia, Mr. Chong Sun Yong, and his details are there. And with that, I want to thank you for your time and look forward to hearing from you. Thank you very much.